Hi there. If you're over 40 and you feel weaker, slower, and less driven than you used to be, that is a warning sign, and ignoring it is costing you. I'm Terry. I'm 64 years old, and I help men fix their testosterone, rebuild muscle, and take back control of their bodies and their lives. On this channel, I don't guess. I use proven hormone-focused nutrition, hard training, recovery, and mindset strategies that get real results. So if you're ready to take back control of your physique, your mindset, and your masculinity, you are in the right place. Now let's get into today's video. That is how to get rid of your man boobs. So let's go. If you're over 40 and battling with some form of man boobs, you are not alone. Recent statistics shows that 65% of men our age, which is 40 to 60 plus, struggle with man boobs. The scientific term is gynecomastia, but here's the truth. It's not just fat. It's often a hormonal war between your testosterone and the estrogen in your body. So what is man boobs, gynecomastia? What does it look like and what does it affect? In this video, I'll break down the latest 2025 science behind boosting your testosterone, which will shrink your man boobs. Gynecomastia, also known as man boobs, is a frustrating and confidence-crushing condition, as I said, affecting up to 65% of men over age 40. While often dismissed as a cosmetic issue, it's frequently a sign of hormonal imbalance, particularly between testosterone and estrogen. For middle-aged men, age-related testosterone decline, weight gain, and medication side effects can all trigger breast tissue growth, leaving many feeling self-conscious and defeated. But here's the good news. Gynecomastia is treatable. In 2025, advancements in hormone optimization, targeted exercise, and minimally invasive procedures often offer solutions tailored to your unique physiology. This video dives into the root causes of gynecomastia, provides actionable strategies to flatten your chest, restore confidence, and reclaim your health. Whether it's glandular tissue or stubborn fat, I have the solution. So let's get started. Here's our medical disclaimer, and it's just important to note that your medical practitioner should always be consulted before beginning any new program that involves exercise, nutrition, wellness, or health. So what is the difference between gynecomastia versus what's known as pseudogynecomastia? You need to know the difference. Gynecomastia is the growth of glandular breast tissue due to hormonal imbalance, while pseudogynecomastia refers to fat deposits in the chest area without the glandular growth. And this is how you tell them apart. You can do a pinch test. Glandular tissue feels firm and rubbery, and fat feels soft. So there is a difference. You can get medical imaging done, which is ultrasound or mammography, that confirms your diagnosis. Why does it matter? True gynecomastia often requires medical intervention, medications, and or surgery, while pseudogynecomastia can be addressed with fat loss and exercise protocols alone. So gynecomastia is a condition where men develop enlarged breasts due to an overgrowth of the breast tissue, that's glandular, rather than just fat. It's different from pseudogynecomastia, which is simply enlarged breast due to excess fat deposits. True gynecomastia typically requires a surgical intervention to correct, while pseudogynecomastia may respond to weight loss and exercise. The physical appearance of gynecomastia can include a mound or disc of glandular tissue beneath the nipple and areola, which can be firm to the touch. Now let's talk about some common myths about gynecomastia or man boobs. Myth number one is that chest exercises alone will fix your gynecomastia. The truth is, spot reduction is impossible. Fat loss requires a total caloric deficit. Myth number two is all chest fat is gynecomastia. The truth is you can confirm glandular tissue versus fatty tissue with medical imaging procedures. So what are the true characteristics of gynecomastia? First of all, there will be a palpable lump, a distinct lump of breast tissue, typically under the nipple. That's a key indicator. It's not just fat. Unlike pseudogynecomastia, which is caused by excess fat, true gynecomastia involves the growth of actual glandular tissue. So that's a hormone imbalance that's causing that. Imbalances in estrogen and testosterone levels are often implicated. It can be unilateral or bilateral. That means that gynecomastia can affect one or both of your breasts. It's not always painful. While some individuals may experience pain or tenderness, it's not always a symptom. So what are the root causes of gynecomastia in middle-aged men? Why does this happen? So you can blame your hormones. After age 30, we all know that your testosterone begins to decline and starts to accelerate on an annual basis as we age. It can drop as much as 1 to 2% on a yearly basis while your estrogen rises. You can add in there medications, obesity, or liver issues, and you've got a perfect storm. Hormone imbalances. So as we said, your low testosterone can be caused by simply age-related declines, which is also at the same time causing an elevation in your estrogen dominance. Aromatase enzymes convert testosterone to estrogen, promoting breast growth. Other causes are medications, anti-androgens, SSRIs, and blood pressure drugs. Health conditions such as liver disease, kidney failure, or thyroid disorders can cause gynecomastia. And of course, obesity. Fat cells produce aromatase, accelerating your testosterone to estrogen conversion. There was a study done recently by the Journal of Clinical Endocrinology that linked low testosterone to 3 times higher gynecomastia risk in men over the age of 50. Okay, here are the steps that you can take to shrink your man boobs. Step number 1, optimize your hormones that means balancing your hormones to shrink the breast tissue. Implement lifestyle changes to boost your testosterone naturally. This includes making changes such as switching to a high-quality clean diet, emphasizing lean protein and healthy fats, start a high-intensity resistance training program, and finally, make an effort to get quality sleep and rest. Step 2, you may need to consider medical interventions in stubborn cases if low T and your gynecomastia symptoms persist. Testosterone replacement therapy, that's TRT, if taken correctly and monitored, will restore your testosterone levels and will suppress your estrogen. But you must be closely monitored when you're on this treatment by your health professional. So topical gels in 2025 also target testosterone without the potential side effects of TRT. These topical gels restore T levels while suppressing estrogen. And here's a 2025 update. Topical gels with targeted absorption reduces TRT side effects. Aromatase inhibitors, that's AIs, those are drugs that block estrogen production. And an example of one is anastrozole. But you must exercise caution because overuse of these particular drugs can actually crash your estrogen, which is going to harm your bone health. Another option is SERMs, that's selective estrogen receptor modulators. Drugs like tamoxifen block estrogen's effects on male breast tissue. A 2024 study from the Journal of the European Urology did a trial showing tamoxifen reduced breast tissue by 40% in just 12 weeks. Step number 3 is surgical and non-surgical treatments to treat gynecomastia. So if you have a very stubborn case, modern medicine has a few options for you. Non-surgical options are one is known as cool sculpting. It's a procedure that freezes and eliminates fat cells for pseudogynecomastia. There's laser therapy, which breaks down the fat and tightens the skin. Then there's actual invasive surgery. One is liposuction, but that's removing fat. So that's ideal for pseudogynecomastia. And then there's a mastectomy. That actually removes the glandular tissue from a case of true gynecomastia. A 2025 innovation involves a minimally invasive scarless technique that reduces recovery time. So the science says that a 2024 study from the Journal of the Plastic and Reconstructive Surgery journal reported that 92% patient satisfaction with a combination of liposuction and mastectomy. So step number 4 is actually preventing recurrence. So you don't want to let it come back. You maintain healthy body fat to keep your body fat under 18% to minimize aromatase. You want to monitor your medications, so work with your doctor to adjust your prescriptions. You want to get regular blood work, so track your testosterone, estrogen, and liver enzymes annually at a minimum. However, semi-annually testing is preferred. So here's a summary for you of your gynecomastia action plan. So first of all, you want to test your hormones, get a full blood panel. That means checking your testosterone, estrogen, and your SHBG levels. You obviously want to make lifestyle changes first before undergoing any kind of medical intervention. So you want to adjust your nutrition to get a lean, high protein diet with healthy fats included. You want to optimize your sleep. Make sure you get 7 to 9 hours of sleep per night and manage any stress situations to reduce your cortisol levels. Only consider TRT or aromatase inhibitors as a last resort. Aromatase inhibitors are a type of hormone therapy that reduces estrogen levels by blocking the aromatase enzyme, which is responsible for converting certain hormones into estrogen in your body. By blocking this conversion, AIs lower estrogen levels for men, thereby treating and or preventing gynecomastia, or your man boobs. You have to be careful with this though, because if you crash your estrogen levels too low, you're going to have bone density problems and joint issues. You don't want that. So you need to burn fat. So engage in a high intensity interval training program or strength training program or a combination of both, and establish a caloric deficit in your diet to lose weight, burn fat if you need to do that. You can consider surgery procedures, cool sculpting or surgery for stubborn cases, and you want to prevent a relapse. So maintain optimum body composition. That means your muscle versus fat percentage, and closely monitor your hormone health and track any symptoms that may arise. So there you have it, guys. Gynecomastia is not a life sentence. Start by fixing your hormones with the suggestions that I've provided for you in this video. You need to burn fat with exercise, and I mean rigorous exercise, and a clean and healthy diet. It will take some time, but just follow my advice and execute the steps I mentioned and be patient. If necessary, you can explore medical solutions for very stubborn cases. By addressing your hormone imbalances directly, you can diminish and eventually eliminate man boobs and restore a masculine chest. You do deserve to reclaim your confidence. So remember, your hormones are the control center. Optimize them and your body will follow. Reclaim your chest, reclaim your confidence. If this video helped, please hit the subscribe button and the notification bell. And in my next videos, I will be diving into testosterone boosting diets, nutritional supplements, exercise protocols, everything for men age 40 to 60 plus. Drop a comment. Have you struggled with man boobs? Let's chat. And by the way, you can pick up my free Quick Start T-Boosting Checklist. It's free. You can pick it up in the link in the description below. Until my next video, reclaim your strength and reignite your life. We'll see you next time.